Hi, I'm Randy Golden from Medical Technologies of Georgia, and I'm here today to introduce everybody to our new uncoated intermittent catheters. And let's take a look at what's inside each package. You get the catheter, and on the male and pediatric lengths we also include the no-touch sleeve, and that's a nice protector so that you don't actually touch the surface of the catheter as you insert the catheter forward. Before you use the catheters, you want to verify French size, length, and catheter tip are as prescribed by your doctor. MTG catheters are available in French sizes 6 through 16 and in Coude and straight tip, as well as in soft or firm vinyl. The soft vinyl is a nice alternative if you've ever had any experience with sensation as you catheterize. So let's look at each of the individual catheters we offer. First of all, the pediatric style are 10 inches long with the appropriate color-coded funnel. This one happens to be an 8 because again it is an international color coding. The pediatric products do come with a no-touch sleeve. For ladies, we have the female length catheter, which doesn't have the sleeve, and the reason being that we felt like there wasn't enough room on the catheter to be able to hold the catheter and the sleeve, and we thought the sleeve might just get in the way. So we offer this one without the sleeve, but again, as you watch the female video, you see how easy this catheter is to insert. For male users, we have a couple different options. The 16-inch long male catheter does come with the blue no-touch sleeve. This is our firm option. We also make that exact same catheter in a softer variety. So if you have any sensation as you catheterize, you may wish to try the soft variety, as it is going to be more comfortable to insert, again with the blue no-touch sleeve. And then finally, we offer the Coude variety. This happens to be a 16, again the orange tip, and you see here the end of the catheter has a little bend on it, and that is designed to get the catheter past any strictures along the way or an enlarged prostate. All of our catheters, whether it be Coude, pediatric, etc., all have rounded, fire-polished eyelets. So they're going to be less traumatic as the catheter passes through the urethra, less irritating. And all of our catheters are DEHP free. There isn't any of the DEHP carcinogen in any of our catheters. Hygiene is very important when you catheterize. Always remember to wash your hands and your genitalia prior to catheterization and afterwards. Okay, so now let's talk about catheterization using the male length catheter and gel. Okay, so the first thing I'm going to do, I'm going to set the catheter aside for the time being, and I'm going to open up my gel packet. And I find a helpful hint here is just to tear away each end of the packet, like so. And you want to just kind of scoot the package together, kind of compress it a bit. What I'm doing here is I'm going to create a channel. I'm going to push the catheter through this channel and coat it with the jelly. Okay? I'm going to set it aside for a second, and I'm going to get back and get my catheter and separate the package here. And I'm going to pull the catheter out using the blue no-touch sleeve. Okay? Now, I want to just scoot the no-touch sleeve down a bit, down the shaft of the catheter. I actually want to get down to right about here, about 6 inches from the end. Now I'm going to go back and get my jelly, and I'm going to run the catheter through the jelly and make sure that as the catheter passes through the jelly, that the catheter gets coated between 8 to 10 inches worth of the shaft of the catheter. See, I'm kind of twisting it a little bit. It's a good idea too, just to make sure that you get all the jelly out of the package. The more jelly, the better. You can never have too much jelly on the catheter. Okay, so it's not the prettiest in the world, but a really well gelled catheter is going to work much better than one that doesn't have a lot of gel on it. You want to get a good bit right here at the end. Okay, so I've gotten that accomplished. Now, go back and get the green funnel. I'm right-handed, so I'm going to do all the holding of the green funnel with my left hand, and I'm going to use the no-touch sleeve to get down to about 2 inches from the end of the shaft of the catheter. Let go of the green funnel, the 14 French funnel. Depending on what French size you have, is going to dictate what color funnel you have. I'm going to insert the catheter into the urethra just like so until I get to the blue no-touch sleeve. Then I'm going to reach back and hold the funnel, scoot the catheter back about 2 inches, and I'm going to continue to advance the catheter at about 2 inches at a time, just like so. You want to go slow, you never want to force the catheter in. If you do encounter any resistance, always take a deep breath, never force the catheter in. Okay. There we go. And now I'm in the bladder, so I'm going to give it one more little additional push to get it right in the center of the bladder, and the urine's going to start to flow. I want to make sure that the funnel is directed down into the toilet to direct the fluid into the toilet itself. And when I see no more fluid flowing, using this blue no-touch sleeve, I'm going to reach back and hold on to the penis and pull the catheter out about an inch, just like so, to see if I have an additional fluid. When no more fluid is flowing, I'm going to let go of the penis with my left hand, and I'm going to reach back and get a sheet of toilet paper from my roll here. I'm going to pull the catheter out of the body. I'm going to use that toilet paper to catch the eyes of the catheter. I don't want to have any spilling. Might be a drop or two left in the tube. I'm going to wrap everything up. Let's get another piece of toilet paper here. Clean off the end of the penis. Of course, I want to wash up afterwards. And then I'm going to discard everything. Please remember that used catheters can be a potential biohazard. Please dispose of these using accepted medical practice. Thank you for watching our video today. If you'd like samples, please go to our website, medtechga.com, where you can get samples of our uncoated catheters, our hydrophilic catheters, and if you're having issues with recurrent urinary tract infections, you can request samples of our closed system intermittent catheters, which are designed to reduce the risk of UTIs.